lesbian, gay, bisexual, transgender, queer, and other sexual and gender minority people are in every county in the United States. We make up approximately 6% of adults and 16% of Generation Z. Little is known about the health of LGBTQ+ people as a whole, and importantly, there are notable differences in LGBTQ subgroups. We are not one monolithic community. So we needed to study how the differences in our identity and our societal experiences influence our health. The healthcare needs of a transgender woman who's just starting hormones in her transition is very different than the healthcare needs of a cisgender lesbian woman, which are very different from those of a bisexual man. LGBTQ+ people are underserved, understudied, and vulnerable to poor health, but they likely have unknown health resiliencies. Because information about sexual orientation and gender identity has unfortunately not been collected and continues to largely not be collected in health studies, we have really a dearth of information about the health of LGBTQ+ people and the influences on that health, including medical therapies and social support networks. We really must conduct this research to ensure that the medical community, including the medical community at Stanford, is developing interventions to help combat disease and promote well-being and affirming therapies for everyone. Recent work from our group has found that negative experiences such as prejudice, discrimination, or victimization were actually correlated with negative physical health outcomes. Conversely, positive experiences such as being out or living in a warm, affirming, and safe place, those were correlated with positive physical health outcomes. I co-direct this work with Dr. Juno Obedin-Maliver, an assistant professor in obstetrics and gynecology, who regrets that she couldn't be here tonight as she's recovering from a recent surgery, but she's doing well. As physicians and scientists, Juno and I take a team science approach, and we wanted to figure out how we could serve all communities better, with a special focus on communities that are the most underserved and the most minoritized. Doing so will help the health of everyone. As graduates of Stanford Medical School, we knew that it was at a place like Stanford that we could find a research home to answer some of these burning questions. Stanford's commitment to equity was why we moved back here to join the faculty 2.5 years ago, and we created the PRIDE Study and the PRIDE Lab. The PRIDE Study is a national online study of LGBTQ adults. More than 22,000 folks have enrolled, and they help us answer the big overarching question. How does being LGBTQ being LGBTQ influence your health, both physical, mental, and social? There are thousands of research questions that we could answer. And in addition to the influence on physical health that I mentioned earlier, let me share a few other findings from our group. Currently, screening questions for problematic alcohol use are based on the sex that somebody was assigned at birth, such as being female or male. We wanted to understand how to screen somebody based on their gender. For example, should transgender men be screened differently than cisgender men? We ended up finding a single screening question that worked across many gender groups. We also study sexual and reproductive health, and we found that transgender men can and want to get pregnant and give birth, and we also found that they can get pregnant while taking testosterone, which was previously thought to be a rather effective contraceptive. To conduct this work, we designed and built our own digital research platform, and we continue to evolve that platform in order to develop new sophisticated tools to recruit participants, to have accurate and complete data collection, and to develop new ways to engage participants for many years to come. We have dozens of papers published and under review, and as part of our innovative engine, we have our PRIDE Lab. We're also building this group to train the next generation of LGBTQ health researchers. At any given time, we have more than 20 mentees in our lab, from high school students all the way through junior faculty members. And they're working on a variety of exciting projects, including cancer, COVID, family building, sexual function, disability, as well as things like resiliency and joy. Mentees present their works during weekly Weeks in Progress meetings and collectively work together to tackle some of the most pressing research questions in LGBT health. Anthony Foe, a postdoctoral scholar in our group, studies things that influence human papillomavirus infection among transgender people. Anthony recently received a prestigious Stanford Propel Fellowship Award, and he found that transgender people were more than twice as likely, compared to their cisgender counterparts, to get the human papillomavirus vaccine if they used social media, and that may be due to validation from their peers. Our research careers began at Stanford as medical students in the mid-2000s, thanks to Stanford's commitment to innovation and diversity. We're delighted to be back at Stanford as part of the new LGBTQ+ health program here, and we're working to enhance the diversity in science and in medicine. Every morning I'm invigorated at the rapid evolution of this field and the promise for high-impact research that will make a meaningful difference in the lives of LGBTQ people everywhere. We will see meaningful advancements over the next years in LGBTQ health, and I'm delighted to be a part of this field and to do it at Stanford. Thank you so much.